Well, Madeline, thank you for doing this. It's nice to see you, however remotely we both may be.
Yeah.
And I know you don't need an introduction, but just for the benefit of our viewing audience, I'm Ralph Izzo, Chairman, CEO, and President of PSEG, and I'm joined today by our guest, Madeline Bell, who wears two extremely important hats. And we're going to prevail upon her to speak about both of those. One, of course, as the President and CEO of Children's Hospital of Philadelphia, probably the leading children's hospital, certainly in the US, if not the world. But she also finds time somehow to be the chair of the Federal Reserve Bank of Philadelphia. The inextricable link between health and the economy today obviously jumps out at so many of us. I welcome you to connect the dots, but I'd like to start on the health front first, if I may, Madeline, and just ask you, we are now in the middle of what clearly seems to be a resurgence of the COVID-19 virus. From your perspective, and to the extent you can make it specific to New Jersey, how much more ready might we be than we were in the spring to manage this virus, and what do you see as the near-term prospects for dealing with it?
So I think, as healthcare organizations, we're much more ready to deal with the latest wave of the pandemic. We know so much more than we did in the spring. We know how to protect our patients. We know how to protect our staff. We've all got many protocols in place. I think we have different treatments available than we did before in the spring, and I think we've communicated and developed better lines of communication with our local and regional governments, and so I think we're in much better shape. I should also mention that many of us have gotten better pipelined for PPE and equipment, and are what we call load sharing with other hospitals in different ways. So in that way, there's a silver lining in that we've all learned a lot more.
I gather that, unfortunately, some of the early lessons we had to learn, just being the first to experience in a big way the spread of the virus, we've been able to share with other parts of the country. Could you just speak a little bit about, notwithstanding what we've learned over 8 months, I'm still seeing some of the press accounts of hospital systems in the Midwest being overwhelmed and the need to set up auxiliary facilities. Were the lessons not transferable, or is it just a limitation of infrastructure?
I actually think the lessons were absolutely transferable. What you're seeing in the Midwest now is, if you looked at a map of the United States on where COVID hospitalizations exist. So COVID positivity rates are important for us to look at, and they're increasing. The percentage of tests that are positive are increasing, but we're also increasing testing. But I think what I really care about as a healthcare leader is hospitalizations, and that's what sort of comes next are unfortunately deaths. And so when you look at the map of the United States and you look at hospitalizations, you will see concentrated in the Midwest lots of red. And unfortunately, what we see will be happening is that wave will be coming to the East Coast, and we're already seeing it happen. We're seeing Ohio bleed into the western part of Pennsylvania, which is, crossing in. When you look at what hospitalizations are happening even in Pennsylvania and Lancaster County, that's higher than some of our more eastern counties. And so, what you saw in the spring, as all of you know in New Jersey oh so well, is that you saw this incredible concentration in New York City that came south. And the southern part of New Jersey wasn't as impacted as the northern and central parts of New Jersey. Now, people in Philadelphia, we think Princeton is North Jersey. I know that it's not, but if I speak in that way geographically, I certainly get that that's really more southern New Jersey for most people.
These waves, these traveling waves, as you describe them, I have noticed, as you pointed out, and as staggering though as the numbers are, I think we've now gone over 11 million in the U.S. Who have been infected, and over 200,000 beyond sad fatalities from it. I think the United States population is 350 million. So we have barely more than 3% of the population affected. Do these waves just continue until a vaccine is widely deployed? I've heard of Sweden talking about herd immunization. That's a little bit scary to me. If we're at 3% now and we've had this catastrophe, what do we need to get to for kind of the herd immunization? So do we just have these oscillating waves or these traveling waves in perpetuity? How does this work?
Yeah, I mean, we're just going to keep seeing waves until, we have a higher percentage of the population that are vaccinated and that people are being more careful about protecting themselves and protecting others. You have to get to about 60 to 65% to get herd immunity in a community. And with, over 330 million people in the United States, it's a heck of a lot of people. So we're not even closely, we're not even there yet. So I think, unfortunately, the vaccination combined with, continual measures to masking and social distancing and hand hygiene will be, really required for a longer period of time. And we're all so tired of it. Nobody, sort of feels like they have the wind for this second phase of this marathon, but, we have to do it, especially those of us in the healthcare community. I think our biggest concern is we are just at the beginning of that wave. And if you looked at the waves, you'll see the spring, the summer, and then this current wave trajectory is much steeper. And so, just in Philadelphia alone, in the last 8 weeks, there's been a 7 times increase in the positivity rate. Really staggering to see that. And so, it's I think it's pretty sobering for us and who live in the healthcare community, and understanding that this is not limited to the impact is not limited to the healthcare community.
Yeah, I know that this is a business and industry webinar, but I know that my colleagues in the business community are concerned about their families, so I'd be remiss if I didn't just spend a few more minutes on this topic. Are we seeing any change in the demographics of the affected population? I mean, do we truly not have to worry as much about children as we thought? And have we gotten smart to realize that the devastating impact it had on our senior population early on, or is it still just a widely affecting phenomenon?
Well, we're seeing an increase of 1 million children from the Midwest. And our colleagues in the Midwest hospitals, and especially children's hospitals, have definitely seen an increase in the number of children hospitalized over the first and second wave. So there's really been 3 waves. The spring wave that the people in the Northeast, like those on this webinar, especially New Jersey, have seen first wave. Second wave was really Florida, Texas. Third wave has really been Midwest, and now that Midwest is moving to the east. So we are seeing more children in this wave than in previous.
I thought I was under the impression as well that a fairly higher level of incidence among younger people as well, whether it's college students and what have you.
Yeah, more adolescents and young adults. Less young, very young children, which is why you see, some of the most recent orders to close schools have been focused more on high schools and less on elementary schools or preschools.
And then could you share with us what your knowledge is on the vaccine? We hear all sorts of things about, well, even though we've seen 94.5% effectiveness of Moderna and 90% of Pfizer, rolling it out will be a logistical challenge. And of course, you want to get it to healthcare providers first and foremost, and the most at-risk general population later. But why would this take a year? And would it be the type of thing where it's sort of flu-like, where we have to get our vaccines every year, or is it once and done, the way it is with some of the polio vaccines or things of that nature?
Yeah, I think we'll have to be getting, well, many of the vaccine candidates are more than one dose. And then some of them would be an annual vaccine. So there are multiple candidates and not all of them are exactly the same. There are some logistical challenges. Some of the vaccines need to be stored at very, very low temperatures. And so as you can imagine, just the logistics of making sure, like our hospital, just as an example, we're looking at like how do we have these sub-zero storage areas, not just at our main hospital, but every one of our 30 some primary care locations and other places where we'll be giving the vaccine in multiple locations. So it comes with logistics that are complicated, and as you can imagine, with the flu vaccine as an example, there's like a well-oiled machine that happens nationally and internationally to get that out there. But this is something new. I think I'm so here. I'm very optimistic about the very positive news about the effectiveness of the first two vaccines that the information has been released. We don't know about everything there is to know, and what you find in the first year of a vaccine being released is, it can't be trialed on every single type of person that exists. So for example, children haven't been really included. So will need to be included in trials. So I think, this is record speed on anything we've ever seen in healthcare community, but logistically challenging, and lots of education for the public that needs to happen about the distribution and the prioritization and how this is all going to work.
Yeah, complicated set of tasks indeed. Well, let's make those explicit links to the economy. As you know, Madeline, we are a large electric and gas utility in New Jersey. We're a monopoly. We have 100% market penetration in our service territory. People rely on us for every conceivable thing, from heating their homes to cooling their homes to lighting their homes. And therefore, they tend to want to pay us for that service. But I'll tell you that our uncollectibles since March are literally double what they would normally be. And for us, that means 9 figures. And so the amount of economic pain that our customers are feeling is real and measurable and shows up in that one particular way. And I'm sure many, many other ways for some of the folks who are listening in on us. Could you just discuss some of the actions the Federal Reserve has taken to counteract the effects of the pandemic?
Yeah, I guess before I do that, I just want to just quickly explain that the views that I'm going to share today are my views, even though the Federal Reserve has multiple economists and who provide information to those of us on the board. I can't represent the Federal Reserve Bank of Philadelphia, which covers a big part of New Jersey, or the overall Federal Reserve. So I just, thought I would mention that to you. So the Federal Reserve has some levers that they can pull during an economic crisis like we're facing. And I think we've all experienced some of those. So let me just kind of run through them. One is they set the interest rate. And as you know, the interest rate has been set at historically low levels, like very, very low levels. And we expect that to stay that way for the time being. So that's one area. The second is they have expanded lending to different broader types of organizations, which I think has really helped. And there's I think the other thing is that the Federal Reserve systems, just like the Philadelphia, has been really focused on what are the sectors of the economy that have been unemployed? And that's largely service workers. Certainly people in hotel and restaurant industries, and people who are part of janitorial services that clean office buildings that have been empty. And so they're also focused locally at the Philly Fed on how do we upskill, how do we get people focused on, how do we focus on training people for other types of jobs, perhaps in maybe in other sectors. Just as a reminder, though, the Federal Reserve has no authority to tax or spend. It can only lend. So while it seems as though they are extremely powerful in influencing the economy, certainly there's only certain things that the Federal Reserve System can do, and certainly this pandemic has had an outsized impact on the economy, and I think that the Federal Reserve has moved as swiftly as possible.
You're back in 2008, 2009. I sadly have very, very vivid memories of the financial crisis, which was, in my mind, more of an asset bubble bursting, and serious concerns early on about liquidity and just having the whole financial system seize up. And when the pandemic hit in a big way in the Northeast back in March, to be sure, some commercial paper markets became a little bit more challenging, and we, despite our very strong credit ratings, were not able to extend beyond more than a couple of days in terms of our borrowings. But it resolved itself very, very quickly. And now we're seeing all term of debt trading rather with ease, with fairly tight spreads. So it feels like, from a participant in the capital markets, that this economic crisis is quite different than 2008. Is that true, or is that just our perspective? And if it is true, then are there an entirely different set of tools that you use this time around versus 2008, or the tools to try to keep the economy going still very similar?
Well, some of them have been similar, like the lowering the interest rates. The Fed is continuing to purchase Treasury securities and agency mortgage-backed securities to, ensure smooth market functioning. I would say that just the expansion of some of the lending categories, I think that's really helped an uptake in people borrowing money, and so that, I think that's got momentum. So there's money out there. So I think there are definitely differences.
Are there numbers, Madeline, behind the numbers? I mean, by that I mean, so we have an unemployment rate, but the interpretation of the unemployment rate varies depending upon how many people want to participate in the employment market or in the labor market. Similarly, access to credit is legitimate only if one has an investable opportunity and a going concern that could support that investment opportunity. So are there statistics or analysis that you're looking at the Fed that suggests no, things aren't as bad as they would appear, or, oh boy, we really do need more action in the way of stimulus from Congress because things are worse than they appear?
Well, I would have to say that during the summer, we saw lots of good signs of the economy returning and actually doing better than had been predicted. But unfortunately, because of some of the shutdowns, I think there's been some erosion in that recently. I think when you think about New Jersey, New Jersey's labor force participation rate is now 61.4%. And the last time that figure was that low was back in May of 1976. And it's really uneven when you look at it. So manufacturing and housing are up, but no big surprise that leisure and hospitality are really struggling. And New Jersey is such an interesting state because you have the shore areas, and the experience of the economy can be really different in the shore areas than in maybe the more metropolitan, in inland areas. So I don't think it's completely even. But to answer your question, I think we definitely did see a rebound of jobs and a rebound of the economy at a greater trajectory than expected over the summer. But I think right now we're certainly heading into another time of uncertainty.
One of the things that I hear from many colleagues in various business forums is how COVID is forcing them to rethink business as usual in a subsequent post-vaccine or post-immunization world. Why do I need to rent this expensive office space? Why do I need to force people to relocate? Maybe I can just as easily retain somebody who wants to be 1,000 miles away than live here. To what extent do you worry about an asset bubble in commercial real estate or some of these potentially major lifestyle shifts having an impact on the economy in ways that we're not anticipating just now, or do we just take the approach that the market will figure that out when it happens?
I mean, I certainly worry about it. When I equate it to my own organization, we have about 6,000 people who are working at home. And it's sort of surprising to hear because we have so many people at the bedside or in the exam room, but we still have a lot of employees that are working at home. And when I talk with other employers and other hospitals like ours that have that, where we lease, we spend nearly more than $9 million a year in lease payments. And when you compound that, across all the different organizations that are leasing space in this region, it is really concerning what that impact might be on the commercial real estate market. On the other hand, I think as an employer, like, wow, this is the great equalizer from a talent perspective. Like now, my talent pool is the whole United States or the entire world, because in certain areas, people are able to work at home. And people can move to parts of the country that maybe have a lower cost of living and still work here at Children's Hospital of Philadelphia. So I try to, I think for, as an employer, and thinking about talent, I think it does open up a universe of opportunities. But it is, as you said, pretty concerning about what this might do to the commercial real estate market.
One of the things you mentioned earlier was the efforts to keep interest rates low so that the cost of money is lower and people can then access the capital markets in a way that's fairly inexpensive. Another tool that the Federal Reserve has spoken of, the chair of the Fed actually, is the need for potentially more stimulus coming out of Congress. We now have a national debt that exceeds the size of our GDP, if I'm not mistaken, or at least approximates it, which puts us in the same club as other countries that have had some significant challenges with the perceived quality of their debt. I guess there's a lot more confidence in the US economy than perhaps some of these other nations. But there seems to be a little bit of tension between maintaining low interest rates and further stimulus that exceeds the receipts that the federal government is taking in. When is the deficit big enough that it requires worry? I mean, I remember a few decades ago, it was, quote, too big then, and we've left those numbers in the dust nowadays. So to what extent does the Federal Reserve think about the overall financial health of the nation from that perspective?
Yeah, I probably can't speak for how the Federal Reserve sees it. What I can say is that, generations to come will be paying for what decisions we're making now, which is really concerning. And I don't think it's getting enough airtime. On the other hand, we have to balance that against the fact that we really do need more stimulus to many people who are probably listening in today. In Philadelphia, where I live and work, on Friday, all the restaurants are closing, all the gyms are closing, any indoor activity. I mean, it's not a complete shutdown, but it's pretty darn close. And I really worry about all the neighborhood businesses that I go to all the time, and that said to me, maybe they're not going to be able to deal with the next shutdown unless they get some type of support to keep their people employed. So it's something I worry about it for hospitals. I mean, we had a $260 million impact on our cash flow in the spring, and our revenue is not back to the pre-pandemic levels. But I'm surrounded by, health systems that have missed their cash flow targets, and their creditors have, consultants in there. So they've pierced their bond covenants, and, two major health systems. And I think we're going to see more of that. And in many areas of the Philadelphia Federal Reserve District, meds and eds are dominant employers. So I think that from small businesses to large employers, there's got to be something that's done, or that the downward spiral will be difficult to pull ourselves back from. So I do think it's a balance, though, the deficit against the current more urgent issues.
Yeah, with all due respect and considerable respect to the many fine health care systems in New Jersey, that trip to 30th Street and Walnut and that area where you're located, I mean, it literally looks like a booming metropolis of healthcare providers. So it's just a phenomenal resource in that regard. Could you say a little bit more about that? That was an interesting comment you made about your cash flows. I mean, here we are reading in the newspapers how hospitals were bursting at the seams with COVID patients, which would, and I know it wasn't thought of this way, seem to be a revenue stream. And yet we did read about, of course, people putting off elective care and things of that nature, but I would have thought that there would be a net positive, but obviously I was wrong. What?
Yeah, not a net positive. A few things happened. One is, the stoppage in New Jersey and Pennsylvania of elective admissions and elective surgeries is an important revenue stream for hospitals. And as you can imagine, the cost to provide care when you're paying 10x for PPE, when you're, paying for overtime, and you don't have, for us, for example, a lot of our patients are international and national patients. As soon as travel restrictions were put in place, literally one day, all of our international patients went away, and those are our higher margin patients, frankly, or people who are traveling across the country. So it really did was turn off those types of services that we provide that are higher margin, and then turned on those that are lower margin and at a higher cost of care. And so all of us in the hospital industry, I don't know of any hospital in this district or even nationally that did okay financially. And we did receive money from the CARES Act, as did many hospitals. And that helped us to not lay off people, which was great. And for many of my colleagues in South Jersey, the same has happened. So, that was important. But yeah, it sort of seems, incongruent to see, people bursting at the seams and waiting in hallways, but to think that the hospital industry has lost a lot of money in it, but it has.
As you described it, it makes perfect sense. You touched upon something earlier regarding the demographics of who's been affected economically by COVID, the service industries and things of that nature. We also touched a little bit about the demographics of who's been affected from a health point of view of COVID in terms of age categories. There have been reports that in addition to categorizing folks by age or by job type, that there have been candidly, some racial disparities certainly in terms of the penetration of the virus among the Latinx and the African American community. Is that, first of all, is it accurate? Is it accurate only in some regions? Is it a national trend? And if any of the answers to that are yes, then why would that be the case?
Yeah, I think this pandemic has put an absolute spotlight on health disparities in the United States, particularly at the national level. Black and Latinx communities. But for this district, for New Jersey, absolutely. So the positivity rate, the rate of hospitalization, and the rate of death is higher in those communities than in the white or Caucasian community. And so we're seeing it in every area, and a lot of it is general lack of access to good health care at a baseline, not having great insurance coverage, lots of barriers to getting good care. One of the things that we've been focusing on is putting testing centers in very underserved communities where we're not asking for people to register. They don't have to show identification. They don't have to pay any money, no copay, all of those things, all those typical barriers. And I think, to do that at a greater degree will be, a good place to start. But I think it's just put a spotlight on a problem that is a public health crisis at a baseline. And then you add a pandemic on top of already communities that already have higher rate of obesity, of diabetes, of asthma, of heart disease, and then you have this type of illness that just makes it more challenging.
Madeline, we talked earlier about the lessons we learned being in the first wave, and then the subsequent knowledge we were able to transfer to fellow Americans as they experienced it. Similar realities existed between Europe and China, kind of being ahead of us, albeit we were quick on their heels, so maybe they didn't learn quite as much as we would have liked for them to learn to transfer to us. But there have been examples of other nations that have managed this combination health and economic challenges better. I don't want to get political or not. I mean, and it's not just the Far Eastern, it's not just Korea and Taiwan, and where you can argue that there's such vast cultural differences that contact tracing is easier and behavioral modification is easier to impose. I mean, you can even see it in places like Germany, which I think by anybody's definition is a Western culture. So to what extent have we been able to benefit from what others have learned, and have we learned lessons from them? And has it just been a question of not being able to successfully implement it, or are the differences so large that there really is no transferability of what they're experiencing?
I mean, I think we've learned a lot. I think it's not a knowledge deficit. It's just a will. It's sort of falling down on the implementation side. Mm-hmm. So, unfortunately, it's a will for everyone to lock arms and say, we know we need to do these several things. And if we do these several things, we're going to protect ourselves and each other. And I think, among my colleagues in the healthcare community, and, right now, every Friday, I'm talking to, all the hospital CEOs. Again, like we used to in the spring, we decided, because things are really heating up, we're surging again, of course. And what we're talking about is how disappointed we are that we're not in a better place. And, maybe I won't speak for the country, but let's just talk about, this district, the Federal Reserve District that we're both in. We know what we need to do. I think, we put these measures in place to also not overwhelm the hospitals. And what I worry about so much, and because we saw this in the spring, is people who have cancer, heart disease, diabetes, other diseases, who need ready access to hospitals and emergency departments are just not going to get it if we're overwhelmed. So, everyone, we're frustrated that people don't get that, because we all as individuals, we want to be able to, if we're ill, be able to get, into an intensive care unit, through an emergency room, and able to be diagnosed. So I think it's not an knowledge deficit. It's the implement. We've really fallen down, on the implementation side. It's the prevention side. We know how to prevent this. It's hard. I think in a country where civil liberties are so valued, and freedom of choice in many ways, it's so hard to get everyone to row together.
Yeah, I think we can probably both agree, though, that it is a sad day when caring about self and neighbor becomes more of a political statement than a simple act of kindness. But I have a couple of boxes on a bench in the foyer of my house that my wife has been after me to put in the basement for the last month, and I've been too busy to do it. And I only have one job. I don't know how you manage to run the world's leading children's hospital and be chairperson of the Federal Reserve of Philadelphia during one of the most challenging economic times we possibly have. So I'm just so impressed by your ability to do that. I'm going to give you a chance to offer whatever concluding remarks that you'd like to offer. But before I do that, I want to say that every day I'm so proud of our employees who show up at work and make sure that folks have the light and the heat that they need to do their job. But among the people they do that for are your employees, who I know I must say, for everybody who's listening, we can't say thank you enough for how they put themselves at risk every day, and in terms of patient care and the risks that they take on our behalf. Truly servants' hearts, every one of them. And we owe them a debt of gratitude that is not easily described. But any closing remarks on your part, Madeline?
Well, just building on what you said, so many of the people that are working at home, some of them are doctors and nurses who are visiting with their patients through telehealth. Mm-hmm. So ensuring that their home has heating and electricity and lighting and all of those things is to me so critical, and it's the things that we take for granted. So it's good to know that there are people out there behind the scenes making sure those things happen so others can reach our patients. And I think even though we're heading for, I think, the next 8 to 10 weeks of a lot of trials and tribulations, and some of it a sort of a redux of what we've already seen, I do think there's a lot of reason to be optimistic. I think people are coming together and supporting each other and communicating better than ever. And I do think that the vaccines and Operation Warp Speed, in my lifetime, we've developed vaccines, many vaccines at Children's Hospital of Philadelphia over our 165-year history. And I've never seen anything like it. And so I think we should be pretty excited about the fact that, there is that hope. And I think combined with some diligence, we will see our way through this. But I think we're headed for a pretty challenging fall and winter. And I think we all just need to, focus on the light at the end of the tunnel, and, hope that there will be some additional government support, just to hold us together, until we get through this next challenging time. But I love the fact that you're getting together as a group of people across different industries, and talking about these topics. And I think you know, what I see, I'm also on the Greater Philadelphia Chamber of Commerce board, is that communication across different sectors is really, really important, and keeping that up and keeping in touch with each other, even if it's remotely, is, I think, really important to our recovery.
Well, thank you, Madeline. Thank you for spending time with us. I know you'll join me in thanking Michelle Siakirka and all of our colleagues at New Jersey Business and Industry Association for making this forum available to its members. I think this may be showing in December, but I'll just say happy holidays in general, and stay safe, folks, and make sure you know who you're dining with during this time.
That's right. That's right. Well, thank you
Thank
for
you.
inviting me.
Thank you.